John Olichny. I graduated from Albany Medical College in 1969. After I graduated from Albany, I went to New York City and did my internship and residency at Roosevelt Hospital. And then I did a year of hematology fellowship with Dr. Harvey Weiss, who was the head of the department and the man who discovered that aspirin is an antiplatelet agent. So we had some interesting things going on. One of the things that I was really happy to be doing was I was the team physician for the Mets for about 20 some years. We went through 2 World Series, 1986, and then again in 2000 where we had the Subway Series. And also I was the doctor for the School of American Ballet. So all the famous ballerinas were in my office all the time. There were all kinds of people walking in. And because it was New York City, we had many of them, Hollywood stars and many of the Broadway people coming through. So I had lots of interesting people that came through my door over the years as a physician in New York. My partner, Dr. Albert Attia, was the physician for the New York Philharmonic, and so I consulted many times with people and covered him many times and had a number of patients from the Philharmonic, and in fact I married one of them, my wife. What I learned at Albany Medical School, many things. First of all, we had lots of very good professors. I liked Dr. Robert Laffin, who was the microbiology head, and he had a real levity about him, a nice way with people, and was a very good teacher. I remember him. I think he was a good influence. I also learned something about humility, because when you get out there for the first time and you're taking care of patients and you're a little bit over your head, you understand that you really have a ways to go in your training, and I think it's a good lesson as well. The advice that I would give a first-year medical student is remember that you're dealing with patients and listen to them. Listening is something that is an art almost. I think that a lot of it's being lost because of the demands of this electronic medical record. It's changed the nature of medicine a lot. What I learned in medical school that impacted my relationship with patients is, I think, just experiencing a way to reach the human element of the patient, because it's always there. People are coming in to doctors and they're scared. They don't want to hear the diagnosis. They've denied things for a while and they come in. You have to understand that, and I think you get to see that the more you question patients, you see that these elements are part of the history, and you have to unearth these issues to be a good doctor. Listening to the patient, that's probably the most important thing I learned at Albany. Albany really prepared me very nicely for the future.